if you haven't studied yoga therapy for a long time, sometimes there's a kind of disconnect between the basic premises of yoga therapy versus other types of healing modalities or Western medicine. And one of them is, this comes out of Ayurvedic texts, but basically that the primary goal of yoga and yoga therapy, right, is to make one more sattvic and make one's like relationship, especially the mental relationship with oneself, a more sattvic one as a mode of healing. So I guess the way to describe that best would be is that even though we're interested in symptom reduction, that's not our only goal. And so a lot of times that gets a little confused. So often, growing up with Western medicine, there's just a lot of thinking towards how do I take this symptom and make it go away, which is obviously natural because we all want our symptoms to go away. But it has to be tempered in yoga therapy with the fact that wanting the symptoms to go away is a desire state that needs to be worked with as well. So, in Ayurveda, they sort of talk about it like, there's different kind of layers of thinking around this and how you would work with it, so that, if you have an herb or a medicine or a technique that'll reduce symptoms, you're going to do it. But most of the big reversals in disease state don't come from that. They actually come from becoming more sattvic in general and having the system work better in general. So maybe a good example of that would be some sort of chronic disease that might be, viral, like Epstein-Barr or something that you'd see with people where they have viruses, sort of in them that there's really no, way to work with them directly. And that's what you see a lot as a yoga therapist, because you're working with people who are having, a difficult time getting better. And so you always move towards this like sort of sattva model. And so in our school, part of that is this sort of way of looking at things doshically, because that's really what you're doing, is sort of how do you take someone and bring them into balance. On a physical level, that can be more sort of obvious, balancing muscle groups so that, now they're more in balance. But that applies all the way to sort of like down the koshic chain, so energetically and emotionally, even sort of spiritually, however you want to look at that, your connection to yourself needs to be tended to, because without that, you can't find true states of sattva, and bigger healings have more trouble occurring. So that could sound sort of trite, like, oh, if you're more in balance, you'll get better, so you want to temper it with, the fact that we don't know, often we know a lot of mechanisms, but we really don't know what actions, we could take to like make the entire system function better, actions like, enhancing immune properties, say. And so yoga therapy can be particularly useful because we have a lot of techniques that move us towards sattva that would theoretically do this, right? So, if the world was going to spend billions of dollars researching this all the time, they'd probably find, that doing, I don't know, you could probably study anything, right? You could probably study like, get 5,000 people to do, 20 sun salutations slowly with their breath every morning, and 5,000 people not to, and discover that their natural killer cells are enhanced or whatever. But those studies aren't going to happen. So, the Western mind is going to have trouble with that. So what we look at is these older traditions, and I think especially China and India, you know, have really good ones. And so we're sort of part of that, where you're looking at techniques to become more sattvic and more balanced, and, you know, and points of view, like the doshic point of view, where you're clumping a whole bunch of symptoms together and saying, okay, this person needs to do this to be more balanced in general, and then their system's going to work better. It would be easy to kind of poo-poo that, except for, you know, as you know, you're all here for a reason, and I bet most of us have seen that there are so many conditions that aren't really helped or helped enough by sort of pharmaceutical models, you know. So you need to, you know, society needs to look at it this way, because otherwise, you know, I mean, the best example is, you know, the United States, where we have okay medical care, and people are pretty sick, you know, relative to other cultures. So clearly lifestyle and the way we move or use our bodies and our sort of viewpoint in general is not conducive to health, just by the evidence. So I wanted to say that, because a lot of people are sort of asking, well, I don't understand, like, I'm trying to alleviate the symptom and you're giving me a doshic point of view or a koshic point of view. I don't understand. Like, what I want is yoga technique matches symptom, but that's not how it works a lot of the time. The only times you might find that working, or most of the time when you see that correlation, you will see it around either physical conditions, or when someone's bothered to study like a pranayama. Someone was here on last Q&A saying, oh, there's this new study, you know, where they use this particular pranayama for PTSD and it went well, you know. And I was sort of highlighting that they only studied one pranayama, so we don't really know if it's the fact that they were sitting there, if it's the fact that they were doing pranayama in general, or that one. So anyway, just things to think about. I want to implant that in our minds while we're thinking about conditions and Western conditions, that is a general principle.